In my husband's words, whatever this guy did, it was good because I've never seen you react to a treatment like this before.
My fine motor skills are slowly returning.
How are your seizures?
I don't have them.
When I got in the car, I had to adjust the mirror because I'm sitting taller.
Yeah, it was really just an overnight response.
I'm able to walk much better than I was initially, being able to move around. My hands have gotten better, my vision's gotten better, migraines have gone away. It's fantastic.
My name is Dr. Marshall Dickholtz Sr. I am licensed in the state of Illinois as a chiropractic physician. I've been researching the brainstem area for 54 years with very, very sharp x-rays. And working in that area, I come to the conclusions that we hope to show you. First thing is I'm famous for lowering blood pressure 17 points in a medical research project. 85% of those patients only got one adjustment in 2 months, and their blood pressure dropped down 17 points. That was a medical research project with a placebo group. But now we've correlated this with many, many other diseases and correlations anyway, and we hope to show you the mechanics and the outcome studies of at least 13 or 14 patients. All right, here we have Melissa. We gave her first adjustment, 8, 12, 11. She had the right side of her breast was removed, and she only was aware of it a month before she had it removed. And she's been with us now about 3 months, and we want to let her tell us anything she wanted about her case. So.
All right, I've been very excited to be into the treatment of Dr. Dickholtz. He adjusted my neck in the beginning of August, and I've noticed significant improvement in my cervical pain and shoulder pain. In fact, I have noticed an increase in energy, even though at the beginning I could tell my body was readjusting to all of the treatment and realigning itself. So in my husband's words, whatever this guy did, it was good because I've never seen you react to a treatment like this before. So I'm thankful to see my immune system improving and hope to continue to see it improve in the future.
All right, she is 35 years young. Before Melissa came here, she did finish her chemotherapy. How long did you have chemotherapy?
3 months.
3
a little
months.
bit over 3 months of treatment.
We were instructed not to start your case until several weeks after you got through with your chemotherapy, so we have a true picture of your blood test. Melissa only received one adjustment, as far as I'm concerned. Until we check her, she's still holding her first adjustment. After suffering, she had cervical pains for 17 years and cold extremities for 15 years, and these headaches, and everything's showing improvement, including her vitality, which is very important. She has more vitality, and that, they say, is very prognostic as far as cancer is concerned.
About a year ago, I was diagnosed with prostate cancer, and I took several months to look around to see what the options were. I knew, because I had been a very healthy person, that I wasn't going to select or choose the traditional Western medicine form of taking care of the cancer. That is radical surgery, chemotherapy, and radiation. I wasn't going to do that. So I was looking around trying to find a resource for taking care of cancer treatment. I found several physicians around the country who does offer normal, natural health care for this prostate cancer. But I have to say that I haven't found anyone that offers the sort of simple, natural treatment that the cervical adjustment that you offer here in Chicago.
Well, you've been here now 6 weeks, and you had an atlas subluxation, and your spine was twisted, And in the x-rays, it looked like there was about 60 years of damage there. But tell me how you've been feeling since I adjusted you. And a lot, also that fact that you gained a couple of pounds.
Gained a few pounds, and I feel absolutely phenomenal. I feel fantastic.
I've had basal cell since I was 33, and then the melanoma started in 95. And I've had 5 melanomas. I've been going to the biomedical center in Tijuana, Mexico for over 30 years. I was having indigestion, I had heartburn, I was getting to where I was getting gallbladder attacks. And I had a lot of back pain between my shoulder blades and right across the PSI joints, low back. I was tired, and I had a lot of swelling. After you adjusted me, within just a few days, there just were absolutely no symptoms of indigestion, any of that. I never had a gallbladder attack after you adjusted me. And I never had heartburn after you adjusted me. I had a little bit of indigestion for a couple of days, and that was it. It was almost a month before my low back went in. And when it did, I got this terrible headache late in the afternoon. And the next morning I got up and that low back pain was gone. And when I would complain to you during the first 28 days, you said, I don't care what happens the first 28 days, everything's just coming back into alignment. So it's like, geez, I can't even whine, you know. And sure enough, it all came into balance.
Well, your atlas only off the thickness of 3 fingernails. So would you think that you're getting younger?
Well, you know what? That's what it feels like. And honestly, I ran into some people that hadn't seen me for over a year, and that's exactly what they said.
You know,
oh my God, you look so much younger. What are you doing?
we have Liza. She's 36 years of age in May '09. Now, you want to tell us something about your case and what have you?
Yes, I was involved in an auto accident in '96, in April of '96, and had a head injury that resulted in seizures, in epileptic seizures. And I had no response positively to medication, and was eventually told that this was just something I had to live with. And so for 13 years, I had epileptic seizures periodically. Sometimes, at the beginning, I had hundreds a day.
Hundreds a day?
Yep.
And that's unheard of.
Right, and then I would have migraine headaches for several days. So I was pretty unfunctional for a number of months. And then they started to resolve somewhat, but never fully, where I was having them still weekly, or sometimes I would go a month or two, but that was the best case scenario. So for the next 13 years, that was my life. I'm unable to drive as a result of my seizures, and makes it challenging in work and in life. And so that's kind of where I was at when I came here.
All right, so we started you with May '09, and now this is 11/9/11. So in that time, you've lost your atlas subluxation correction about 6 times. That's pretty good. It's only averages about twice a year. I've been adjusting you. And when you're in adjustment, how are your seizures?
I don't have them.
That's it. When you're out of adjustment, and recently you were out of adjustment maybe for a month or two, and your seizures came back.
Yes.
Now, I adjusted you last week, and what happened to the seizures since I adjusted you last week?
I'm not having them.
So we have a direct correlation to being in adjustment or out of adjustment as far as your seizures are concerned.
Absolutely, 100%.
Now, I also take care of your daughter.
You do.
Even though she's not here, can you tell us about your daughter?
I would love to. She had migraine headaches on a daily basis that were severe. And we didn't want to medicate her for them because of her young age. She was only almost 11 years old when we came here. And you adjusted her, and after the first adjustment, literally instantly she stopped having migraines. It didn't take any time at all. They just went away.
I got her card in front of me, and we've been seeing her for a little over 2.5 years. And in the 2.5 years, she only lost her adjustment 3 times. And that shows you that she didn't hit her head.
No, and
A good adjustment will hold.
And she's an active kid, a very active kid. She's not a China doll. She does a lot of sports and activities.
So here we got evidence of epileptic seizures, migraine headaches, and 2 healthy individuals because of a nuclear chiropractic adjustment. I'm interviewing the mother of Ty and Max. I'd like to have it be noted that we use the NUCA technique, and we use only 1 adjustment on both these cases. Now we'll talk about Max first, because Max has been here since 4/16/08, and now remember it's only 8/13/08. So can you tell me about the progress that we've made with your son?
I'd say I started to notice changes actually right away. Max was kind of a quick responder, so the first day I saw a lot of red cheeks and blood flow, pretty hot that day. The next morning he actually took off his glasses that he had been wearing for about 6 months. He took them off and didn't want to wear them again. So we actually took him back to his developmental optometrist, and she reevaluated him and said that he didn't need to wear glasses any longer. I'd say also about 2 days after his adjustment, he lost a lot of his sound sensitivities, sensitive to loud noises. He also lost, hey, honey, don't goof off. They love the camera.
All right.
And he lost tactile sensitivities in his hands to touch. Since then, we've just seen continued motor coordination, bilateral integration, able to ride in a 2-wheeled scooter, learn to swim, that sort of thing. It was really just an overnight response.
All right, now let's talk about Ty. Now Ty, we adjusted Ty a month and a half ago, and 1 adjustment only, and at that time, I think you told me you were standing on his head for an hour to 2 hours to get rid of headaches.
Yeah, he was complaining a lot of headaches, and so he'd actually end up doing a headstand or standing on his head on the couch, sometimes for up to 3 hours a day, just to get rid of the head pain.
And now he doesn't have any head pain?
No, he doesn't do any of the headstanding anymore.
And what else have you noticed in him?
Well, he's also had a lot of gastrointestinal problems, so trouble digesting food, responding to any sort of new food with diarrhea, muscle pain, seeking belly pressure, always wanting to press on his belly, and we just haven't had any of that.
And today you said no headaches, and he has no GI problems, the volume of his voice is better, and his speech is improved, and better eye contact. We have 2 astounding cases here, a husband and wife, Arthur and Cynthia. We've only gave them 1 adjustment. Now Arthur, when he first came here, he was told he had Parkinson's disease, and his voice was affected. He had headaches and nervousness and what have you, dark circles. So we only gave him 1 adjustment 13 months ago. And Arthur, tell us about how you've been doing.
I've been doing much better. My speech was affected, and it's a lot clearer.
And how about the Parkinson's? You move your arm better? Before you said you couldn't move your arm.
My fine motor skills are slowly returning.
As ordinary Parkinson's disease case, people get worse, and you're getting better.
Yes.
I'm very happy to hear that. Now, otherwise, now we got your wife here. We gave her also only 1 adjustment 8 months ago. And Cynthia, your main complaint was dorsal and lumbar pains, irritable bowel syndrome, headaches, and low thyroid, lack of vitality, TMJ. How are all those symptoms coming along?
Much better. The major thing was I was very hunch-shouldered, and now I'm straight, and it doesn't hurt to be straight, so that's the best part of the whole thing.
You got more vitality? And your TMJ is not bothering you like it
No.
used? No TMJ.
No TMJ.
Irritable bowel syndrome, there's a tough one.
I've been doing really good with that too. No problem.
Remember these cases here? Cynthia, we adjusted only one adjustment 8 months ago. She had a right, what's called right subluxation of 1 1/4 degrees, very small. And her husband was supposedly a Parkinson's disease, and he had a right subluxation also of 2 1/2 degrees. And he's only adjusted for 13 months. So apparently they haven't had any parties where they hit or whip their head. Or
No major traumas.
no major traumas.
No.
That's what knocks out adjustment. Yeah, Megan, she's 35 years old. Her main complaint when she first came here, only 2 months ago now, her main complaint was migraine headaches. And how many years do you have migraine headaches?
Like 2?
Yeah, about 2 years.
At least.
And other than that, she had other symptoms too. And now, today she comes in. Remember, we only gave her 1 adjustment 2 months ago. Her atlas was misaligned 2 degrees, by the way. Now, you want to tell us anything you can about your case now? The progress you've made in 2 months?
I used to have tingling in my hands, and that's completely gone. I haven't had any migraine headaches. In the last, after 30 days, about 45 days in, I had a huge difference in my energy, just feel more energetic. I've had a lot of infertility problems that were unexplained, and my cycle has changed from what was very abnormal to what appears to be the normal now.
You've been surprised.
Yeah.
Dysmenorrhea. That's a lot easier now?
Oh yeah, huge difference. I had tons of cramping, it's all gone.
Isn't that fantastic? You had poor facial color, you got more color in your face?
Yep.
And you say you got more vitality.
Yeah, much more energy.
We have Therese here, and Teresa is 67 years young. We gave you one adjustment a month ago, and actually a month and a couple of days ago, and you've seen some results already.
Yes.
And first thing, did you feel the adjustment?
No.
You didn't feel the adjustment?
No.
We don't go in deep. You had an atlas complex syndrome, or an atlas subluxation, and your atlas is off 2 1/2 degrees as far as maybe some chiropractors listening to this. And you complained of dorsal and lumbar pains for 40 years, and how's that coming along?
I have no more pain.
After 40 years, all right? And you told me a few other things today. You said you had some discharge from the sinuses. You want to tell me about that?
That's correct.
And your breathing was better through your nose?
That's correct, in the left side. That's correct. There was postnasal drip that occurred after the first adjustment, and within 2 hours, the left nasal cavity was open for full breathing.
And before it was closed most of the way?
About 70%, I would say.
For how long?
30, 40 years.
30, 40, that's
Yes.
Unbelievable.
Yes.
And you mentioned that about dorsal pains in the middle of your back you had for 40 years, and how's that coming along?
There's no more pain.
After 40 years.
That's correct.
Here we have Shirley, age 56 at the time she came in here, and she was complaining of trigeminal neuralgia on her left side for 5 years, and she also had poor facial color. That's what we recorded. She had an atlas subluxation of atlas right 3 degrees. Her head was leaning to the right 7 degrees, and her lower cervical, and this is for chiropractors, by the way, this information, her lower cervical angle was off almost 7 degrees. And in this time that she'd been here, and today is March 7th, 2011, and she's only lost her adjustment once because she, from one accident or another. But all this time, and that is a matter of 15 visits, she's only lost her adjustment once. So tell me about your case, Shirley, and how you progressed since you've been here.
When I came here, I had horrible pain. I couldn't even drive in a car on the way here. I had to sit on a pillow. And since I've been coming, I have noticed that my pain has subsided. I can sleep on a bed now. I had to sleep in a bathtub for almost 3-4 months.
3 to 4 months sleeping in a bathtub. That's
yes,
amazing.
Sleeping in a bathtub would only help me with hot water. I had to sleep. After that, I would sleep on a recliner. Since I've been coming, I say a couple months after I started coming, I started sleeping in my bed. I've been sleeping in my bed every night. Feel better. I don't have that horrible pain anymore.
The pain is all gone.
Stabbing pain.
Today, all the pain is gone.
I would say, yes, the pain is pretty
After
much
5
gone.
years of suffering, this is trigeminal neuralgia. It should be, it's considered the worst pain a person could have is trigeminal neuralgia. And remember, she only lost her adjustment once in about 9 months.
Mm-hmm.
And
I feel great. I mean, I suffered with stabbing, burning pain, and it was pretty bad.
now here we're in Chicago, and she comes from Indiana, so she drives a few miles to see me. So apparently her trips were worthwhile.
Oh, yeah.
And we want to thank you for your testimonial. All right, here we have Man. He's been a patient of mine for about 11 months now, and he came here with complaining of lumbar pains and left sciatica. How many years did you have that before you came here?
About a year and a couple of months.
All right, I would mark down 14 months. I never marked that on my card. All right, what is remarkable about your case is your atlas, or the first vertebra, was off 3/4 of a degree in side slip. That is maybe only about 1/10,000 of an inch, and that was enough to affect your nervous system. We will cause a stressor for the base of your brain. And on his examination, the hips were tilted 5 degrees. That gave you a scoliosis. And we've seen enough damage there. They say that you are 60 years old, and we saw enough damage saying that you did not walk straight for 60 years. All right. So what do you think about about walking, and what do you think about your improvement and your sciatic problems and your lumbar pain and sciatic problem?
Oh, there's been a remarkable improvement. I mean, I would say that on a scale of 1 to 100, I feel 90-95% okay, beautiful. Right.
But one more time, what's remarkable about this case is vertebra was off only the thickness of one fingernail, and the atlas is side slip. That's the first vertebra. And we gave one adjustment back in January the 21st, 2011. And today is December the 7th, 2011, and he has not been adjusted since. One adjustment. He hasn't hit his head apparently all these months, and we're very happy to see that he's holding his adjustment. And he's using chiropractic the way it should be, as a preventative. He's coming in right now about every 3 months to make sure that if he loses his correction, his hips will be tilted again, and before the pain can develop, we will give him another adjustment and balance his hips and take the stress off the base of his brain. So therefore, other weaknesses in the body may not show up to the forefront if we keep the stress off the base of the brain, and that's the way chiropractic should be used. Dr. Teresa Wanchek, she's been a doctor of osteopathy. You've been here almost 2 years now, and you only lost your adjustment once. Right. Can you tell me the progress you've made since you've been here?
Well, I can say that I stand more solidly symmetrical. I have better strength. I have better reserve. And I know that it's been a very good thing to have this adjustment.
At one time you told me you had lumbar pains for 20 years, lumbosacral pains for 20 years.
Sure.
So how's that been coming along?
That's much, much better. I hardly have it at all.
And you had cervical stiffness for 40 years. How's your neck been feeling?
Much better.
All right, that's fantastic. Remember, she only lost her adjustment once in almost 2 years. All right, here we have a strange case of Julie. As beautiful as she is, she has a strange case. And she's been to the Mayo Clinic,
yes.
right?
Yes.
And they told you she had a fluid mass in her brain near the pineal cyst?
Well, a pineal cyst and also an arachnoid cyst near the base of my brain.
An arachnoid cyst. And what did they want to do about it?
Well, they told me that they believed there was a 50% chance that they could relieve symptoms by doing surgery and resectioning the lining of the brain and draining the cyst.
And you didn't go ahead with it?
And I did not go ahead with it because I felt like that if it was only a 50% chance that my symptoms would be relieved, that it could be something else.
When she came here, a year and a half ago, she mentioned that also feel your pressure in the posterior portion of her head for 2 months. Headaches were constant since February, and loss of grip strength, and intention in the occipital area, poor balance. The lower mandible was swollen, and you couldn't hold the head up. And she was taking steroids for 2 months, and poor color. You're looking more beautiful now. So tell me, all those symptoms showing improvement?
Yes, yes. My balance is a lot better. My grip strength is better. The headaches are nearly completely gone. I feel a lot better. I don't have the trouble with my jaw swelling.
Well, it certainly shows that us giving you a nuca adjustment. It's an upper cervical adjustment, and it relieves your symptoms.
Mm-hmm.
And although you lost your adjustment a few times, when you are holding your adjustment, you're doing great.
Yes, I definitely can tell the difference.
Debbie, she was diagnosed with multiple sclerosis, which is considered one of the most serious diagnoses you could have. And she came here. In June 28, 2010. Now, Debbie, you went, besides complaining of multiple sclerosis for a few years before you came here, you had poor control of your hands, and your left eye was affected, migraine headaches for 20 years, cervical pain, shoulders were tight, paralysis in your feet, and occasionally lack of vitality. That's a whole list of symptoms. Now, we only gave you one adjustment a year and 6 months ago.
Yeah.
So tell me how you've been feeling since I adjusted you.
I'm feeling a lot better, and considerably better, especially since the first round back in June 2010. Really from the standpoint of I'm able to walk much better than I was initially, being able to move around, my hands have gotten better, my vision's gotten better, migraines have gone away. It's fantastic.
And considering the serious disease, diagnosis of multiple sclerosis, I think this is a case we could call a miracle response, and to showing the value of a nuca adjustment. We have Maria. She's 78 years young. She came here with dementia for 4 years, and she doesn't speak very much English. When we got Elaine, her daughter, here to help us, but when we first came in here, 10/4/10, that was 3 months ago, she complained of dementia for 4 years. Her feet burn at night, ringing of the ears, tinnitus, right hip and legs painful, and her face was white. She didn't have any color in her face, and she had cold legs at night, high blood pressure pills, loss of sleep, swollen ankles. And now we're talking to Elena, and Elena has told me, oh, by the way, she did have a quadruple bypass in 1996. One more time, she's 78 years young, and we started this case 3 months ago. Now today, Elena told me, and you correct me if I'm wrong, Elena, she's got better appetite, she's feeling much better, and her alertness is 50% improved. So she's, as far as dementia is concerned, she is making a tremendous recovery. Remember, only one adjustment, by the way, only one adjustment,
Right.
3 months ago. And she's 50% improvement in being cognizant, eating better, no leg pains, there's less swollen ankles, better circulation, and she feels warmer, and she's sleeping better, and overall, Elena, what else would you say? You tell us what you think about some of these symptoms we just talked about.
Definitely she's been improved. Her appetite's gotten a lot better. Her awareness is better. The coloring is she's more alive. And her medications, we're able to cut them in half.
That's tremendous when you cut medication in half. And it's possible one of these days, even she may not need any medication if her blood pressure will stay what we call the normal range for her age. So I'm very pleased that we got this nice young lady getting younger instead of getting older. You're getting younger instead of getting older. If your body's functioning better, you're getting younger. We have here Jim. He's got very severe scoliosis, or at least 40 years. We saw him 12 days ago. We gave him one adjustment, and we wanted to let him tell us what has transpired in 12 days. So speak up.
Well,
everybody wants to hear about your story.
Well, first thing I noticed is I've been sleeping a lot better.
All right. And better. In other words, you were sleeping poorly for how many years?
No, I was sleeping all right, but it's noticeably better.
All right.
And ever since, every night.
And for 12 days, that's pretty good.
Pretty amazing. And I was standing taller, walking taller. I know when I got in the car, I had to adjust the mirror because I'm sitting taller, and I could, and so people are telling me, "Oh, you're standing straighter." It's very good.
And you were bent over how many years?
About 10 years.
About 10 years.
Yeah, it was getting worse and worse, and this made such a difference.
You stand up and show the people on the tape. I stand up as straight as you can now. Compared now, before, how far were you leaning forward before?
Well, I don't know. I think it was
Yeah,
sort of
that,
like
that
this.
is more like that.
Sort of
That's
like
right.
this most
And we
of the
got you on
time.
videotape for last
And I
time.
had pains in my back because I was always trying to stand straight, and these muscles would be very sore from all of my efforts to stand straight. Now I can stand pretty straight.
Yeah, I don't think you said this straight. It's been limited the car here. I saw 50 years of damage on your X-rays.
Yeah.
And now you're standing so much straighter you don't believe it yourself. I bet you.
It's wonderful. Yeah. My wife says you're taller.
Well,
so that's pretty good. So I'm really pleased. I taught a workshop Saturday, 2 days ago.
Yes.
3 days ago, and it's from 8:30 to 5:30. It's a long day.
Yeah.
And usually, over the last couple of years teaching these workshops, I've been worn out by the end of the day. And now today, at this time, it was a piece of cake. I enjoyed it a lot.
You got a lot more vitality.
Oh, it's really terrific.
You're getting younger,
Yeah.
whether you like it or not. So if you took the stress off the base of your brain, you're getting younger. All right. So tell me something now. She had any reaction, good, bad, or indifferent, since I saw her last?
Well, her walking is better. Her leg.
I marked down walking better. Can we do that?
Yes, sir.
Walking
And
better.
her leg lengths, as far as we measured last time, are equal now. They were about 1.25 inches
That's
difference, I believe. I think the right leg was 1.25 inches longer. And then also her weight bearing, I believe her right leg might have been 60 pounds and her left leg around 30 pounds. And now they're almost identical. Her weight bearing seems to be equal in both legs now, around 45 pounds plus, per leg, within 1 to 2 pounds. She just seems to be doing real well. She goes to school still, and she on the weekends she does the usual activities that people like to do. She likes to go to movies, and she goes to church, and she has been active. She really hasn't had any residual problems from the procedure, and she just is overall in better health. And I think with passage of time, well, as far as her walking and her her legs and just her general physical activities.
Okay. Your activities improving in any way, shape, or
Yes,
form?
and I believe they will get better over time. As
No,
her
we're
body-
only talking about a week. In fact, it's only been,
It's only been
say
a week. Yeah, it's been 1 week. So
1 week is nothing. But on the other hand, we're trying to see if they're, even though it's only a week, sometimes we see some recovery in a week, and we like to make a positive notation. And I mean, socially, is she any better socially? Is she talking a little bit better? Or interaction any better?
well, she's been doing the reports from school. She's been doing very well.
The reports
and
from
they
school-
didn't
and the
compare
reports
it
from
to
school-
prior, but
And the reports from school changed in this last week.
well, they've been positive, and I didn't ask them to compare it to prior, but they've been positive, and that she is. Yeah, actually, one thing was that she had her lunch, and she ate all her lunch and ate it more quickly, so that some of the slowness that she has seems to be improving.
I think that's tremendous.
I think it's tremendous.
Eating faster, not slow.
Right, and also eating all of her lunch, and at a normal rate of speed. All in all, everything has been excellent.
These pre and post full spine x-rays showed a tremendous improvement with one adjustment. Taking stress out the base of your brain balances all the muscles of the body. This was published with 44-degree scoliosis in a 15-year-old young lady. It went down to 32 degrees. Remember, that was one adjustment, and the spine was continually changing shape even after these x-rays were taken. Here's another case that you should find very astonishing. Shirley with Arnold-Carrari formation. That means the tonsils of the brain are coming through the frame of the magnum. And when part of the brain starts to come through there, they operate the base of the brain and open up the frame of the magnum, they enlarge the base of the brain, a hole there, and they cut off the rear section of the first vertebra. All right, she had migraine headaches for 20 years, paresthesis in the right hand for 30 years, and pains in her neck for 20 years. She was referred to Mayo Clinic for this type of surgery. Just before she went to Mayo Clinic, her father-in-law sent her over to my office. All her symptoms cleared in 8 weeks. She was holding her first adjustment
there's an Arnold Carrari questionnaire. And here is a questionnaire we gave her. And you'll find that most of the things she said were positive where she had the Arnold Carrari information. Now, she filled out another questionnaire later on. The symptoms were negative.
I had a car accident and my heart rate raced up to about 140 beats a minute, and my blood pressure went up roughly 140 over 100. And back pain, a little bit of headaches, ringing in the ears. But I couldn't find any chiropractic technique, any medical. I was being adjusted, but it wasn't working for me. And so I resolved myself to having to have 5 blood pressure medicines to try and keep the heart rate down and blood pressure down. About 2 years ago, I was at a seminar and they presented the technique, and they told me you have to see Dr. Dickholtz. He's the best in the world at this. Made the call and came up from Indiana then to treat with him. So in about 6 weeks, my blood pressure started going down, and I was on 5 blood pressure medicines. I don't take any now.
There are many techniques in the field of chiropractic. The only thing is, basically, when we're dealing with the spine, we're dealing with solid structures. And basically, I like to say I'm not a doctor per se, I'm a spinal mechanic. And the more accurate you are in being a spinal mechanic, the better results you're going to get. The technique I use is called the NUCA technique, meaning National Upper Cervical Chiropractic Association. I'm last of the founding directors of that organization. Now, we do have a sister organization called Upper Cervical Research Foundation, and I'm the last of the founding directors of that. So the point is, we are going ahead as fast as we can to get research published. But the thing is that we want to get you to understand that when you're dealing with solid structure like the neck and the head, we have to have measurement. And in the NUCA technique, we do have certified chiropractors that deal with this type of measurement. And consequently, I equate it with doing brain surgery with no blood and what have you. And it's very easy and it's painless. And we hope to show you, by showing you the spinal biomechanics, what we are doing. Here we have what we call a lateral film of a 16-year-old boy. Now the neck, there should be a small curve in the neck like so. His head is leaning way forward. He was probably born with forceps, and that's why his spine is so distorted. Now this is a side view called the lateral film. This is what's called the nasal film. The tails of the vertebrae called spinuses. These are the spinuses like this. They're little tails. And look at the curve here. It should be straight. This line goes through the skull. Look at his head leaning severely this direction and his neck leaning this direction. If we draw a vertical line from the middle of the neck up, you can see how the distortion of the neck and of the head. That's before we adjust them. After we adjust them, it was painless and bloodless. All right, we use our hand on the edge of the atlas as a crowbar, and look at the changes. Here the spinuses now are in the middle of the line of the body. The head is straight. It only took me a couple of minutes to do that. In fact, any certified NUCA chiropractor can do the same thing. Now we showed you 2 dimensions. The third dimension is from the top of the skull. We're looking at through 2 layers of the bottom of the skull and the top of the skull to see the first vertebra. This is the first vertebra. This is a pre-X-ray where the vertebra, the way we measured, was rotated left side anterior 1.5 degrees. After we adjusted the case, it came down to 1 degree. 1 degree in his case could be normal. But you could actually see the first vertebra going through 2 layers of the skull to see the first vertebra. From these X-rays, we get a certain dimension where we are supposed to stand like a golfer aims to put a ball in the right direction. I have to aim with my body. So from these X-rays, the vertebra went off to the left, and over here it went forward on the left side. So we're going to show you a model on the table and show you how we did correct this case. This is the back of the skull, and this first vertebra is the atlas, and the atlas does not have a bony interlock. And we want the atlas to be underneath the skull, assuming you're born with the bottom of the skull level. Now the atlas can go off to this side or this side. We have to know which side it's gone off so we can slide it in the proper position. Then also the atlas can rotate this way or this way. And if you don't know how the side slip and the rotation is, we know how to place the patient on the table and put our hand on the edge of the atlas and move the atlas in the right direction. It's highly directional. It's like a golfer aims to put a ball in a hole-in-one on the golf course every time he hits the ball, and he aims with his body. The chiropractor aims with his body to get and make a contact on the first bone, use that as the lever to move the head and neck in the right direction. Here we have perfect balance where the head is in the vertical axis. That's the line going through from the base of your neck up. And the neck is in the vertical axis. And the first bone, if you draw a line through the first bone, it's called the atlas. It is at right angles to the head, assuming the bottom of the skull is level. In most cases, they are. Now, if ever anybody's born with forceps or has a whiplash injury, the neck may be knocked off to one side, the head counterbalances. That's one way. Another way is that maybe the head is straight and the atlas goes off to one side like that. So otherwise, there's 1,500 different combinations. Not only is it what's called the frontal plane, but the atlas can twist and the neck can twist forward and backward. All this is taken into account when we adjust our patients. From the x-rays, it said the atlas went off to the left and forward. So we lay the patient on the table on their side. We brace the head near the tip of the mastoid, and we bend over, and the atlas is right here. We put our hand on the edge of the atlas. We put our two hands together, and we aim our whole body in the direction we want the atlas to go to move the head and move the neck. Remember, the atlas is the only vertebrae you can use as a lever. And as we compress our shoulders, we only have to dent the skin at 1/16 of an inch, and a reflex takes place, and the head and neck move. The brain is a million billion live connection that doesn't want you to die. And that is what we're working with. What we're trying to get to correlate as at top of the spine is like the fuse box of the whole body. And it's like putting in a new fuse. And if we can put the brain in better control of your body, many, many symptoms and diseases show an improvement. Of course, we're talking about multiple sclerosis, we're talking about migraine headaches, epilepsy. But all these cases, I only do one thing in this office. That is to take stress out of the base of the brain by balancing the head on top of the neck.
It's remarkable, and it's not painful. Every time Faye gets adjusted, she says, "I didn't even feel it."
Thank you. I appreciate your assistance in getting me back into shape.
You're the most excellent chiropractor, and I'm most grateful to you.
I want to acknowledge Dr. Young Chung, who's been my associate for many, many years, and he assisted me in all my research programs. Thank you. We have demonstrated in a couple of these cancer patients that their immune system function better. There'll be a couple more cases on my website that you can see more information. But basically, this is not proof. To have proof, you need a placebo group. And someplace, maybe in the future, we will have a placebo group to correlate what we're doing. And thank you. On the 35-year-old breast cancer case, we are using blood tests, $1,800 worth of blood tests for every time she went in. And 3 of the major indicators of your immune system, 2 came back to normal, and 1 was towards normal in 8 weeks' time. So we're showing that the immune system can be brought into play when you take stress out the base of the brain. On the prostate cancer case, he's been with me about 13 or 14 months now, and he's got a tremendous amount of energy. And remember, though, the big thing is, as the body's response was that increased the PSA tremendously, what could be a positive thing. And he's enjoying great health. Remember, I've been taking care of him over a year. But remember, the lymphatic tumor shrunk from 36 to 2. That's a large percentage. with no medical intervention for the lymphatic tumor.